So that's quite a significant difference in the delivery of healthcare compared to what we experience on the civilian side. And what about the veterans themselves? How are their needs different from those of civilian patients we may interact with, and how do and in what ways might they be the same?
Um, by the time they're in the military, and of course they serve and they retire, by virtue of the fact that military has a physical standard, a physical and mental health standard to enroll in the first place and to stay in the military, there is a healthy effect, if you like, so that anybody with any significant conditions, like inflammatory arthritis, inflammatory bowel disease, existing coronary disease, all those people will be weaned out. So the people who join are basically fit when they enroll. And therefore, many of the conditions that you may see in the general population will not arise in the same rate in the military population. So so they are slightly healthier than the general population. I think in 2010 or so, there was a comprehensive mortality study done by Health Canada and Stats Canada, and it found that in every single condition, military, as anybody who served in the military for any length of time had lower mortality in every category except aircraft accidents. And because of the military, pilots are engaged in more dangerous operations, they tend to have a higher mortality rate in that regard. And there was an indication at that time, this is over a decade ago, of mental health suicides rising probably to a rate higher than the civilian population. And I think over the last decade or so, because of the effects of the Afghanistan campaign and so on, that probably has risen. So that two major issues that affect veterans are really musculoskeletal and mental health. Musculoskeletal is somewhat self-explanatory in the sense that military service is quite hard on the body. So many of them have difficulties with their, ankles, feet, knees, hips, backs, necks, and shoulders, and so on. So that's probably a rate that's probably higher than the general population. And now with mental health, most prominent one being, post-traumatic stress disorder, depression, anxiety, and those are the key mental health challenges. And associated with the mental health, often they have some issues with dependence and addiction to alcohol predominantly, but maybe some drugs also.
So that paints a very different picture than I think might be a stereotype of veterans potentially having a higher mortality rate or perhaps more complex healthcare needs than the civilian population. Are there any other myths that you've come across in treating military veterans?
It is a common myth that they have multitude of complicated medical conditions. I would say they don't. However, there are different demands because of their service, and as I said, mental health is one of them, and that's a very complex and challenging area. If somebody has significant mental health issues, and and something that probably is at a rate higher than the civilian population in terms of PTSD in particular. And then, of course, almost all military doctors are almost by definition sports medicine physicians. And so if you are uncomfortable in the MSK area and ways to manage chronic pain in particular, then you may have some challenges. So these are difficult areas when it comes to chronic pain and chronic mental health issues.